Good morning. I'm Ronny Pipes with the Center for Depression Research and Clinical Care at the University of Texas Southwestern Medical Center in Dallas. Our FHIR integrated application is VitalSign 6 for depression screening and clinical decision support for measurement-based care. I'd like to recognize our consulting partners, Dan Cornish of Integrated Services Incorporated, who is our design architect for the application from its inception, but wasn't able to be here this morning. And then Steve Munini, who's here with me today, of Helio Software. Steve helped us to get our application completely FHIR and Smart on FHIR compatible. We are a nationally recognized center for excellence in research and the treatment of mood disorders, and our vision is a future free from the burden of depression. Our center's founder and director is Dr. Madhukar Trivedi, professor of psychiatry and internationally recognized expert with more than 500 publications. I want to tell you a little bit about the current state of depression and its treatment. 1 in 6 people will experience an episode of depression during their lifetime. It often begins during adolescence, which is earlier than once thought. Women are twice as likely as men to experience depression. There are both genetic and environmental factors that contribute to depression. Of those with depression, only 47% are recognized clinically. Only 24% receive any treatment whatsoever. Only 9% receive adequate treatment, and only 6% achieve remission of symptoms, which is the goal of treatment. In recent years, laws have been passed and policies that have mandated universal depression screening of all patients at least annually. When depression is detected, there must be an effective plan to address it. This requires the participation of our primary care physicians. There just aren't enough psychiatrists to cover the need. Our VitalSign 6 model seeks to make depression screening the sixth vital sign. We have 2 main goals for achieving our mission. One is the implementation of routine evidence-based depression screening, and the other is to make scientifically validated measurement-based care for depression the standard of care in every clinical practice. VitalSign 6 is a web-based application to assist with screening, diagnosis, and treatment of patients with depression. All the measures are scientifically validated patient self-report measures. VitalSign 6 enters the measures data into the depression treatment best practice guidelines algorithm to produce personalized clinical decision support in real time at the point of care. Our program helps equip primary care and family medicine physicians to treat depression effectively to the point of complete remission of symptoms. These are a few of the core measures used in measurement-based care for depression. VitalSign 6 currently has 23 self-report measures that can be used at the provider's discretion. I want to share with you a bit about the success that we've been able to accomplish with VitalSign 6 since its inception in 2014. The majority of our clinics have been low-income populations serving underinsured or uninsured patients, and many of them are staffed primarily with volunteers. Here is a comparison of remission rates. The 6% on the left is the one I mentioned earlier. This is the national average for remission rates for people who experience depression. The one in the middle 28% is the rate of remission achieved in the landmark STAR-D study, the largest depression study ever done to date. STAR-D demonstrated that outcomes in primary care settings can be equal to that of specialty care psychiatry clinics if primary care providers adhere to the best practice guidelines promoted in VitalSign 6. And on the right, these are the remission rates that we've been able to achieve in our clinics. And these are representative actual clinics. Among our high performers, Clinic A is 59% remission rate. In the average range, this is the second clinic, has right at a 39% remission rate. And then our lowest performing clinics, this is representative at 20% remission rates. Since August of 2014, we've screened 47,000 patients. 20% of those screens have been positive. Our cumulative remission rate is at 36%, which is 30 points above the national average. We believe we can still do better. Now I want to show you the app. Here, clinic staff log in via one of several methods of authentication available in VitalSign 6. This is the patient search screen. FHIR allows VitalSign 6 to search the clinic's EHR to pull the patient data into VitalSign 6 so that the patient does not have to be entered into a second application. Here the clinic staff selects the provider, the preferred language of the patient for the measures, and the visit type. The depression screening measure that we use is PHQ-2, which assesses for the 2 core symptoms of a major depressive episode. There are 9 symptom domains in all, and if the PHQ-2 is positive, then VitalSign 6 presents the remainder of the items in the PHQ-9, which assesses for the other 7 symptom domains. The patient completes all of the items in the measures and then returns the tablet to the clinic staff. Now Steve Munini is going to show you how the FHIR integration works within VitalSign 6.
Morning, everybody. Thank you, Ronny. I'd like to start by thanking Ronny. He has been a wonderful person to work with, just fantastic individual, and really truly dedicated not only to treating and potentially a cure for depression, but also the technology behind a lot of this as well. So I'd like to talk a little bit about about some of the core use cases that we implemented for this project. And we've actually integrated this at 2 sites, UDSW initially, and also Children's Health also in Dallas. The core use cases are as follows. There's a patient use case, which Ronny just showed you. What really happens is there's a tablet that's handed to a patient, and they complete the questionnaire that way. And also a clinician use case where the clinician is inside of an electronic medical record. Both of these implementations are epic, actually, and we're continuing with other deployments with other EMRs. So a couple of lessons learned, I guess, from these implementations. Right off the bat with both of these projects and the projects teams, it's important to know that there's not only technology people involved, but also both of these projects had clinician representatives and organizations involved in a lot of the decision making in terms of how the application functioned, what types of capabilities were present, and so forth. Right off the bat, a heavy requirement from both implementations to get the data back, the results of the VitalSign 6 set of recommendations and notes and so forth back into Epic. That was an absolute requirement for both of these implementations. And we actually did it two different ways for both of these pilots. In the case of UTSW, that was probably the most high-tech approach, where we actually enabled a write-back capability via Cloverleaf, and I'll show you how that works a little bit. In the case of Children's Health, we went with more of a slightly manual approach, but a very functional approach where there's a copy and paste approach back into an Epic note. So different styles of doing that. Relative to the authentication, what we also discovered is, as much as we would have liked to use, we did use Smart on FHIR for application launch. What we ended up doing, however, for the tablet approach, where we handed the tablet to the patient, there's actually a login by the provider or an office staff member first. The feedback we got back really was that they didn't feel that during the office visit there was enough time really to for the patient to log in using MyChart and so forth. A lot of these visits were simply 15-minute visits. All right, so briefly I'm going to go through this. There's two use cases here. This is the patient approach. I won't walk through the whole flow chart, but Epic actually handles the first two questions in the assessment relative to signs of depression. And if there are some initial signs, then VitalSign 6 is then enabled at that point. And you can see on the bottom that we do a patient search using FHIR. We do get data directly from Epic. We get a lot of data. We get encounter data, condition, procedure data, and medication statement data. And we do write that data back using the questionnaire response FHIR resource, using a post that way. Again, on the clinician use case here, where a clinician is in their Epic EMR, we do something very similar. Although we do a Smart on FHIR launch for this application, and then we get a lot of that data back. And we actually use the condition resource, the procedure resource, and also the procedure request resource on the write back. So let me walk through a very rapid demonstration, video demonstration here, where I'd like to highlight several areas of the integration, and yeah, that's playing. So the first is, you'll see here, prior to this integration, VitalSign 6 was really a standalone application, and you can imagine a lot of the challenges relative to getting patient data and just finding patients and so forth. You'll see a very simple MRN search. Prior to the integration using FHIR and Smart on FHIR, this was a back-end batch type job that occurred, and sometimes some of that patient data wouldn't be exactly up to date. Sometimes a patient who arrived that same day was not available in VitalSign 6. There was duplicate data entry going on between VitalSign 6 and Epic, for example, and sometimes that would be incorrect or done wrong, and there would have to be a reconciliation process. So all of that is really gone relative to what we've been able to achieve with FHIR. The next part of the video here is going to showcase some of our capability relative to the follow-up plan. So this is really a lot of the core decision support capabilities of VitalSign 6. So really what's possible now that we have a lot of this data relative to FHIR, is we're able to kind of rationalize and align a lot of the diagnoses that exist between both Epic and FHIR direct and VitalSign 6 directly. So you'll see here that in one case there's major depressive disorder that exists inside of Epic, but doesn't really exist inside of VitalSign 6. So Further on down, what you're also going to see here is now that we have access to medication data, it's now possible to make better decisions and more effective decisions relative to dosing decisions for these patients. So you can see we're kind of notifying the VitalSign 6 user that certain medications were discontinued or in Epic, and we need to mirror that also in VitalSign 6. So, okay. Just really one more quick slide here relative to the Smart on FHIR launch. We're able to achieve a very successful and very easy to use Smart on FHIR launch of VitalSign 6 directly within Epic. And here's a couple of screenshots of that copy and paste approach where we did enable kind of a copy of information from within VitalSign 6, and if you pasted it in a progress note in Epic, it looks like that directly. That's the second case there, and then the final case is the more automated approach where we're doing that right back to Epic directly, through Cloverleaf. And with that, I'd like to thank Ronny once again. It's been a great project, and we hope for more in the future. Thank you very much.